Good morning, everyone, and welcome back as we return from the holiday season to continue our work in the Economic Opportunity Subcommittee. Without objection, the Chair is authorized to call for a recess at any time. Today's hearing is entitled Reviewing the Availability of Resources to Address Veteran Hunger. I'm hopeful we can shed some light on a very important issue for veterans around the country. This hearing will examine Department of Veterans Affairs and Department of Agriculture programs that identify food insecurity among nearly 20 million veterans and provide nutrition assistance to those in need. Specifically, today's hearing will focus on how veterans access nutrition resources, how recent policy changes have impacted the availability of resources, and how Congress can more effectively support public and non-public agencies that seek to end veteran hunger. So critically important. This continues the subcommittee's efforts to review economic factors that contribute to veteran suicide, which we know include homelessness and hunger. Our subcommittee works in a bipartisan way to strengthen education and job training programs so veterans can get a good job, but unfortunately that's not always the outcome. Sometimes joblessness results in a veteran and their family members experiencing hunger. When that occurs, nutrition resources should and must be made readily available. However, this committee is concerned that decisions are being made regarding these resources without thoroughly considering the impact on veterans. This subcommittee and Congress as a whole need to know how USDA considered the effect on veterans as they proposed regulatory changes limiting access to nutrition programs last year. If veterans were not considered, we must understand why USDA felt it was unnecessary or that they were unable to do so, and how we can ensure that veterans are considered now and in the future. In addition to ensuring the availability of resources, it is essential that we help veterans secure them. Since 2017, VA has screened millions of veterans for hunger, but it is unclear how that policy is being carried out and what VA is doing when a veteran in need is identified. The many federal and state programs that assist veterans who are experiencing hunger can only be utilized if veterans are aware of them. This is a particularly fitting matter for our subcommittee, which has spent this Congress on policies to improve veterans' economic outcomes and ultimately their overall wellness. We have a responsibility to ensure that no veteran falls through the cracks. And I look forward to hearing the testimony from our witnesses today to do just that. With that, I now recognize my friend, Ranking Member Bill Arakis, with whom I've worked on a bipartisan basis now for 5 minutes for his opening statement.
Thank you, Mr. Chairman. I appreciate it. Mr. Chairman, I want to thank the witnesses as well who will testify today on the important issue of veteran hunger. Food security for veterans, as well as all Americans, is an essential component for a stable life. Food insecurity can be a contributing factor that could be detrimental to a person's mental health. It is important for us to evaluate the way we are providing the security to ensure that it is being provided in the most effective manner to help those who need it the most. Mr. Chairman, neither of us were members of Congress when President Clinton signed the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, also known as the Welfare Reform Act of 1996, into law. By the way, that was a bipartisan bill and a good bill, in my opinion. But right now, states are bypassing its original intent. This law was a bipartisan effort, as I said, to require work or training for work in exchange for the time-related financial assistance. This law also included incentives for states to get those in need back to work as a means to reduce the fiscal burden on the federal government and prevent what we now call, and I quote, multi-generational poverty. So we want to prevent multi-generational poverty, something that, again, that's what we should be striving toward, and I know that that's your goal as well. Broad-based categorical eligibility allows states to circumvent income and asset requirements to extend the Supplemental Nutrition Assistance Program, or SNAP, benefits based on nothing more than an individual receiving a brochure or pamphlet. Currently, of the 2.9 million able-bodied adults without dependents that participate in SNAP, 2.1 million, or 72%, are not working. Additionally, the number of people currently participating in SNAP still exceeds pre-recession levels. I'd like to hear from our panel today on why they think this is happening. With such a low unemployment rate, why are we seeing so many SNAP participants continue to not work and live on these benefits? I'd also like to hear from our panel ways Congress can help lift these people out of poverty and allow them to prosper in this booming economy. With that being said, under this administration's leadership and our continued use of pro-growth policies, the national unemployment rate is now 3.6%, with veteran unemployment rate at an even lower rate of 3.3%, again for the month of November. Mr. Chairman, it is obvious that the economy is booming. Americans are returning to work in record numbers, and encouraging employment is the foundation for Congress's authorization of this program, a great program, which is why I'm supportive of the administration's rule on able-bodied adults without dependents, which implements the existing work requirements from the 1996 law. President Clinton in the Republican House really focused on this and got it right. But how does this apply, in my opinion, to this subcommittee? Unfortunately, we know surprisingly very well about how this program affects veterans. We simply do not have the idea on veterans using the SNAP program or how prevalent food insecurity is among veterans. Mr. Chairman, you were not here when the Farm Bill was authorized last Congress, so you may not be aware that despite requests from our side of the aisle, the federal government still does not require states to conduct meaningful data collection on SNAP participants, including tracking of veterans. Now, I know that we have veterans that are having a real hard time because I participate in those standout programs at least on a yearly basis. But not tracking the information, by not tracking both Congress and the Department of Agriculture, USDA, are left in the dark about how to improve this program. I would very much like to work with you and our colleagues on the House Agriculture Committee to address this issue by putting in place a requirement for states to track SNAP benefits for veterans, our heroes. My priority in the Congress, I know it's yours as well, Mr. Chairman. Some states already do this, but not all states do this. I'm grateful to our witnesses for giving us an opportunity to hear directly from those involved with this program. I look forward to hearing what they believe works, does not work, and how we in Congress can empower those involved in these programs to ensure that no one who has served our great country goes hungry. That's the bottom line, and that's our goal. Once again, I thank you, Mr. Chairman, for holding this hearing, and I yield back the balance of my time.
I thank the ranking member for his remarks. I too have participated in veteran stand-down programs in my district and appreciate our shared objectives here and look forward to working on a bipartisan basis with you. With that, I'd like to recognize my friend, the outstanding chairman of the House Veterans Affairs Committee, Mark Takano, for his opening remarks.
Thank you, Chairman Levin, for yielding a little bit of time to me this morning to make my opening remarks. Good morning to all of our witnesses. Thank you all for appearing before this subcommittee. Like many of our committee members, I was concerned by the SNAP changes that took place last year and how, in particular, they would impact veterans, but also active duty, Guard, and reservists. The Guard and reservists, in particular, often face employment challenges. And so, we need to find out more. We need better data. As with Chairman Levin and many members of Congress joined in sending a letter to Secretary Perdue at the USDA on May 24th, 2019, reflecting our many concerns. Without good data, we don't know the scope of the program, we need data that can be done in conjunction with VHA appointments, but also other interactions like awards, changes in benefits, and also with vulnerable populations like homeless students and the homeless population, students, and transitioning veterans. Many questions exist. So I do appreciate your joining us this morning. We are very, very concerned about how the changes in the terms of SNAP benefits are going to affect our nation's veterans, active duty, guard, and reservists. Thank you, and I yield back.
Thank you, Mr. Chairman. Appreciate your interest in this subject, your continued leadership. That brings us to our witnesses. We have two panels with us today. The first representing the administration, and the second made up of non-governmental policy experts. First, I want to thank USDA for joining us on this important topic. From USDA, we have Pamilyn Miller, Administrator for the Food and Nutrition Service. We also have Dr. Thomas O'Toole, the Senior Medical Advisor at the Providence VA Medical Center. Thanks for being here. He is accompanied by Christine Going, Co-Chairperson of the VA's Ensuring Veterans Food Security Workgroup. Thank you all very much for joining us. As you know, you'll have 5 minutes for your oral statement, but your full written statement will be added to the record. And with that, Administrator Miller, you're now recognized for 5 minutes. And make sure your microphone's on.
Thank you, Mr. Chairman, Ranking Member Belarakis, and members of the subcommittee. I am Pam Miller, Administrator of USDA's Food and Nutrition Service, which is responsible for administering the nation's nutrition assistance programs. I'm pleased to be joining my colleagues from the Department of Veterans Affairs and appreciate the collaborative relationship we have had in serving veterans together. We all owe great debts to the veterans who've protected and defended our nation. They've earned our respect and honor, and they certainly deserve our support as they may face the challenges of life after military service. F&S programs are not targeted to veterans specifically, but provide food assistance that veterans and their families may need, particularly in tough times. The largest program, the Supplemental Nutrition Assistance Program, or SNAP, currently serves about 36 million low-income Americans each month. Census data suggest about 1.3 million veterans reported receiving SNAP in 2017. Let me make clear that because veteran status is not a condition of SNAP eligibility, we do not have veteran status as a part of the data sets that we use to estimate the impact of our rules. Congress debated the collection of this information during the last Farm Bill and decided that it was not necessary or appropriate at this time. So I will focus on the purpose and effects of the administration's SNAP reforms. The goals of these actions is to align the program with the statute established by Congress to reduce inequities among participants and encourage households towards self-sufficiency. Those eligible to receive nutrition assistance should be treated fairly across this country. Over the years, states have set policies that compromise consistency with certain standards defined in statute, thereby allowing households in one state to be eligible for SNAP or to receive more in SNAP benefits than households in another state. Last month, USDA finalized a final rule to help more able-bodied adults between the ages of 18 and 49 who do not have dependents, or ABODs, into promising futures through job training and employment. With a robust economy, unemployment at a 50-year low of 3.5%, and more than 7.3 million job openings, there's no better time to engage this group of SNAP participants to get the skills they need to be successful in the job market. This rule does not change work requirements for ABODs that were set in the 1996 Welfare Reform Law and have been unchanged in every Farm Bill since. Time limits do not apply to children, their parents, pregnant women, the mentally or physically disabled, or anyone 50 years of age or older. Importantly, the disability exception includes veterans who are totally disabled, permanently homebound, or in need of a regular attendant. Those subject to time limits can receive SNAP for 3 months in a 3-year period unless they are working, volunteering, or participating in training, such as SNAP's employment and training program or one of VA's work programs, for at least 20 hours a week. These limits account for the fact that not all participants are fit for employment. States must screen SNAP participants for their ability to work and can exempt part of their caseload from the time limit at their full discretion as established in law. The final rule did not change any of these policies. What it did was clarify when and where states may seek to waive time limits for those who do not meet the ABOD work requirements. Previous regulations were defined so loosely that counties with unemployment as low as 2.5% were waived areas. Implementing the limits where jobs are available encourages ABODs to realize their potential, have a sense of community, and move towards an independent lifestyle. 2 other SNAP proposals are pending. One would eliminate a loophole called broad-based categorical eligibility that's been used to provide SNAP benefits without conducting a robust eligibility determination, resulting in benefits going to households that exceed statutory income thresholds. The other would modernize the calculation of states' standard utility allowances, which are important in calculating SNAP benefit amounts. Under current policy, in one state, an elderly person is receiving SNAP benefits 2.5 times as much as an elderly person across the state line in a similar situation, simply because of the standard utility allowance. Both proposals promote a level playing field for SNAP participants, with all treated fairly and consistently. The comment period for each is closed, and FNS is analyzing comments to determine next steps. Other USDA nutrition programs also help veterans, and I'm happy to address those as well. So in closing, I'm confident we can provide Americans, veterans heroes, with the services and support that they deserve. Not only a nutritional safety net, these programs can help launch participants on a path toward better health and a better life. Thank you, and I'm happy to answer any questions you may have.
Thank you, Administrator Miller. Dr. O'Toole, you're now recognized for 5 minutes for your opening statement.
Good morning, Chairman Levin, Ranking Member Bilirakis, and distinguished members of the subcommittee. Thank you for the opportunity to testify before you today on ending veteran hunger. I'm accompanied by Ms. Christine Going, the VHA co-chair of the Ensuring Veteran Food Security Workgroup. There are 3 points I want to emphasize. First, not having enough food to eat is very real for too many Americans and for too many of our veterans. Second, the consequences of this food insecurity extend far beyond just going to bed hungry. Its impact is seen in a litany of physical and mental health conditions, preventable ER visits and hospitalizations, and avoidable deaths. Finally, the Veterans Administration has a strong and demonstrated commitment to do all we can to address it. One veteran experiencing food insecurity is one too many. According to the most recent Department of Agriculture survey data, more than 11% of all households and almost 1 in 3 households at less than 130% of the federal poverty level experience food insecurity. Now, this is despite the robust economy and record low unemployment rates we've been experiencing. Among veterans, while the overall rate is lower, specific populations, including younger veterans with families, women, low-income veterans, and those with underlying depression and psychiatric illnesses, are particularly vulnerable. In one study, 27% of Iraq and Afghanistan war veterans reported food insecurity. In another, 48.5% of homeless and formerly homeless veterans lacked regular access to food. The consequences of food insecurity are substantial and significant. Research has consistently shown the link between lacking regular access to food and poorly controlled hypertension, diabetes, HIV disease, asthma, depression, anxiety, and suicidal ideation. Among older adults, it is associated with reduced activities of daily living and being over 2 times more likely to report poor health. Food insecurity is a social determinant of health. That, along with not having stable housing, living in poverty, experiencing violence, and others, are strong predictors for suicide risk among veterans. And several international studies have explicitly linked food insecurity and suicide risk. It's within this context I would like to shift to what we are doing about it. In early 2016, the Veterans Health Administration launched the Ensuring Veteran Food Security Workgroup to partner with other government and nonprofit agencies in identifying veterans at risk, training VA staff, and coordinating resources and initiatives. Milestones from these past 3.5 years include implementing an electronic medical record screening tool for identifying veteran food insecurity. To date, almost 100,000 food insecure veterans have been identified and assisted, men and women who might otherwise have gone unnoticed. Streamlining enrollment of veterans into the Supplemental Nutrition Assistance Program, or SNAP, including partnering with USDA and Maison to create veteran-specific education materials. Training programs for staff, including a toolkit for registered dietitians to support food insecure veterans, and expanding on-site or mobile food pantries at VA medical centers. There are currently 57 food pantries in place at VA facilities, including the 17 VA Feeding America pantries that alone served more than 40,000 veterans and their families 700,000 meals. To conclude, having enough to eat is a basic human need, and in this country, no one should be going without food. It is a major determinant of health that needs to be viewed no differently than how we consider access to medication or to primary care. It is intimately linked to health and the ability to prevent and manage a variety of health conditions, not the least of which include mental health and suicide risk. Across the VA, we are committed to providing the highest quality care our veterans have earned and deserve. Going back to the 1921 Veteran Bureaus Act legislation, we have an explicit duty and mandate to the health, well-being, and welfare of those who served. While we proudly note the progress made to address food insecurity among our veterans, there is more we can and will do to decrease veteran hunger. Moving forward, we need to increase the number of food pantries at our medical centers to address the urgent need for food. We need to assist and facilitate enrollment in SNAP to ensure more consistent access to food. And we need to address the root causes of food insecurity through social determinant of health-focused interventions. Thank you again for the opportunity to appear before you today, and we are prepared to answer any questions the committee may have.
Thank you, Dr. O'Toole. With that, I recognize myself for 5 minutes to begin the question portion of the hearing. And I did notice the citation that Congress previously rejected veteran data tracking in the previous Farm Bill debate. And I'm a freshman member of Congress, that's true, so I wasn't here. But it's my understanding as well that Congress rejected the very rules that you're here defending today. And I might still be a freshman member of Congress, but I do have some sense of the actions taken by this body in recent years, particularly my role chairing the subcommittee. Dr. O'Toole and Ms. Going, a couple questions for you. What proportion of the veterans who screen positive for food insecurity does VA assist with SNAP eligibility screenings, application assistance, or referrals?
Thank you, Mr. Chairman. Thank you, Mr. Chairman. All of our veterans who are screened positive are provided assistance. I'd like to defer to Ms. Going on some of the specific interventions that our social workers and registered dietitians do engage in that process.
Thank you, Mr. Chairman. Yes, any veteran who is screened positive is initially offered a consultation with a social worker and/or a dietitian. And in both cases, then the care is customized to what the veteran needs. And one of the questions is, are you currently receiving SNAP? If they are, then we provide them additional services. If they are not, then we assist them in applying for SNAP benefits.
So VA does then monitor ongoing food security or SNAP participation for veterans who initially screen positive for food insecurity?
We don't monitor exactly who has SNAP or who does not. It's part of the individual questioning, but it is not data that is captured.
So you do not, okay. How has the VA collaborated with USDA and with community partners to create resources or materials to help raise awareness and respond to veteran food insecurity as it exists?
Thank you, Mr. Chairman. We have worked with USDA and Mazone to develop veteran-specific material on how to apply for SNAP, and we have also engaged nationwide that each facility is responsible for developing very specific lists of resources because the resources are different based on each VA. So each facility has been asked to establish that list based on their local resources.
It seems to me that's a good start. It seems that we can always be doing better. And I guess I wanted to ask, what is preventing VA from taking more proactive efforts to respond to the needs of veterans who've screened positive for food insecurity?
Well, Mr. Chairman, I would agree with you. There is always more we can do. And I think that is actually one of the efforts and activities that we are actively engaged in through this work group. We clearly need to be as proactive in connecting veterans to services, but I think also ensuring that the consequences of food insecurity that may be manifest in worsening health or mental health are also being concurrently addressed.
Thank you for that. Administrator Miller, in considering the proposed rule regarding SNAP time limits for able-bodied adults without dependents, did USDA consult with VA or analyze the impact, specifically the impact on veterans? And if so, how many veterans did you determine would be impacted?
We have data that does encompass the entire SNAP population. So as we were putting forth the rules and looking at our regulatory impact analysis, we looked at our entire SNAP population and how they would be affected. And in there, it does include veterans. But as I said, we don't have specific data sets on veterans because Congress has not given us that authority to collect those types of information.
Did you consult with VA?
We did not consult with the VA.
Did you analyze the impact on veterans specifically?
It would have been part of our entire SNAP population data set that we collect.
But not specifically?
Because we don't have that data, because it's not a condition of eligibility, we are not able to specifically assess that.
That's important to understand. How about for the proposed rule on broad-based categorical eligibility?
The answer would be the same. Again, we look at the impacts on our broad SNAP population, but if Congress were willing to engage in technical assistance and have conversations, so if Congress gives that ability to collect that data, we're certainly happy to do so.
And I assume the answer is the same for the proposed rule on the standard utility allowance?
Yes, sir.
So despite the fact that you say that you didn't have the congressional authorization to carry forward a dialogue with VA, nonetheless you knew your own statement, I believe you said 1.3 million veterans received SNAP in 2017. Isn't that what you said?
Yes, sir.
So then you knew that veterans were a uniquely important community as part of the SNAP program, did you not?
Our program serves all low-income Americans who need assistance, and so they would have been captured in our data sets for the entire SNAP population.
So veterans have no significance, additional importance to you, given their service to our nation, where even a phone call to VA was warranted?
We certainly want to make sure we're serving all low-income Americans, including veterans.
But that's a no. You never contacted VA.
We did not contact VA.
Thank you for that. I'll go ahead and yield to the ranking member for his questions.
Thank you, Mr. Chairman. I appreciate it. Ms. Miller, we're interested in better data collection for veterans, as you know, in SNAP. What is the most efficient way to gather that information?
The best way to gather this information is through the SNAP application process. And so when we have more detailed information through the SNAP application process, that's the best way for us to gather that data. But if we are to require on the application that households report their veteran status as a condition of eligibility, that does require a statutory change, and that's what we are lacking at this point.
Okay, would it take an act of Congress to get FNS and the states to collect that information? Why can't USDA require states to provide this data on their own?
Because it would be adding a condition of eligibility to the SNAP application process, which requires a statutory change. What we are embarking on is a study, and it would be a survey that would include a question that would help us understand veteran status. And so we're embarking on that now that will help us maybe get to some of that data without having to change the SNAP application process.
So would FNS find it useful?
Yes, sir. If we could collect the data, that would be useful.
Okay. Second question, USDA just finalized the able-bodied adults without dependents rule. Why does USDA believe the criteria for state waivers from the congressional mandated SNAP work requirement need to be changed?
What we have seen right now is we have a very robust economy. There are more jobs available than there are people who are seeking jobs, and so this is an opportunity for us to really engage these able-bodied adults without dependents with the resources to help them get into the career field. We've got our SNAP Employment and Training Program. We can also work through the VA's work programs and so many other of our federal, state, and local partners to help engage this population. We've seen areas with the unemployment rates as low as 2.5% that have been waived. And so we think this really is a good opportunity to engage these people and making sure that ABODs are able to return to the workforce.
Okay, for the benefit of the public, when do these changes take effect?
The final rule will be implemented April 1st.
April 1st?
Yes, sir.
Okay. Why are you making these changes when the Farm Bill, the 2018 Farm Bill, made no changes?
We have the authority. Our authority was retained so that we could address this issue. And so using our authority that we have, we're able to do this final rule.
Okay. Has this administration done anything to change the congressionally mandated work requirements that were passed as part of the 1996, again, the Welfare Reform Act, implemented by Clinton, Bush, and the Obama administrations?
No, sir. This final rule does not change the work requirements. It does not change the time limits. And as you said, this first was passed on a bipartisan basis, signed into law by President Clinton, and it has remained unchanged for more than 20 years.
All right, very, very good. Thank you, Mr. Chairman. I'll yield back.
Thank you, Mr. Ranking Member. I'd now like to recognize Mr. Pappas for 5 minutes.
Well, thank you very much, Mr. Chairman, and I share the concern of many folks here that too many veterans are food insecure. Too many are experiencing economic hardships, including not knowing where their next meal is going to come from. So I think we all need to leave here with a sense that there's so much more to do for those who have worn the uniform of this country, pledged everything to the United States up to and including their lives. And it's our job to be able to make sure that they're taken care of. I wanted to just build on a question that Mr. Bilirakis asked you, Ms. Miller, about these rule changes. He asked you for a rationale about why these changes were made, why you sought to propose these rules. You responded by saying we have the authority. I think we're not doubting the authority, but can you explain a little bit more about the rationale and also talk about the broader population that will be impacted? How many will lose SNAP benefits as a result of these rule changes?
Sure. Again, using our authority, we were able to implement this final rule. But what we are seeing is that there, again, are more job openings than those who are seeking jobs. And so knowing this is an able-bodied adults without dependents, so we're talking about individuals between the ages of 18 and 49. The states have a responsibility to be sure they're screening everyone for their assessment for work. And so we are hopeful that if we can engage this population, we can really put them on a path towards a better future. States do have the ability to exempt a certain percentage of their caseload if they are having difficulty finding work or re-entering work. But we have had employers reach out to the SNAP program about how can we engage with SNAP participants and make sure they're getting job training and skills that they need to help fill some of the jobs that are out there. And so again, this is just given the economy right now, this is a great opportunity to engage this population.
So the chairman asked about data for veterans specifically, and you said you didn't have that data, but you do have numbers for the broader population of SNAP beneficiaries and how that will decrease as a result of these rule changes. What's that number?
688,000 is what our estimate showed in FY21 that may not meet the work requirements and so may lose SNAP benefits.
680,000. So we're clearly talking about thousands of veterans among that population. I think we can extrapolate that figure pretty safely. And we've got to do all we can to make sure that those vets get what they need. I appreciate the work of the working group and what you're doing to ask the question and identify ways to help our vets I'm wondering, Mr. O'Toole, if you could talk a little bit about those vets that are not seeking care at the VA and what the work group is doing to reach out to the broader population. As we talk about, mental health and suicide, for instance, we know that most of the vets that are dying by suicide are not connected to care at the VA. Similar situation here with food insecurity and those vets that aren't being reached by these programs. So how do we get out? How do we get to them, and how do we reach them?
Thank you, Mr. Congressman, for the question. And I think it's an important one to acknowledge, in that Veterans Health Administration and those enrolled in care in the Veterans Health Administration represent only a proportion of all those men and women who have served our country. The VA has launched several initiatives, principally through our suicide prevention program, as a means of engaging some of those veterans at highest risk and in need and in crisis to try to bring them into the system. You're right to note that many of the suicides are occurring among veterans who are not enrolled in VHA. Several initiatives undertaken to help bring some of those veterans into our system, as well as to provide community resources to them, include the other than honorable discharge capacities for veterans to seek emergency care and other care within the VA system. And I think bringing them in within that venue is clearly an option and an opportunity. I'd like to defer, though, to Ms. Going for specific issues within the work group that may speak to some of the community partnerships you referenced.
Okay.
So thank you, Mr. Congressman. The work group has on an annual basis done education that is intended to the field as well as to the outside. So our educational opportunities were advertised to our community partners so that they could participate. So you did not have to be a veteran utilizing the VHA to be able to listen and participate in our educational series. And we are currently working on a podcast that will also be forward-facing and allow anyone to hear it. It's not limited to just veterans receiving care within the VHA.
Okay. Thanks for your work. I yield back.
Thank you, Mr. Pappas. We'll get to Mr. Bergman in 1 second. I just wanted to make sure I understand one thing. You know the number of veterans that receive SNAP. You know the number of overall SNAP beneficiaries that you think will be impacted by this proposed rulemaking. And yet, you cannot tell me how many veterans will be impacted by this proposed rulemaking. So I'm going to ask both agencies, since you're both here, can you commit to work together to inform this committee how many veterans will be impacted by this proposed rulemaking?
We're happy to work together and look at the data that we have and follow up with you, sir.
Okay, so we'll follow up and we'll make sure that we do everything we can to get that data, because it's very important that this committee understands how many veterans are impacted. And with that, I'll yield to Mr. Bergman for his questions.
Thank you, Mr. Chairman, and thanks to all of you for being here. And I appreciate Chairman Takano's reference to the Garden Reserve. And I wish, unfortunately, he could have been here to stay, but I guess this is going to be recorded on C-SPAN or somewhere so he can view it if he chooses. But you know, we've got challenges. It's not news to anybody, and that's why we're having this hearing. But when it comes to the Garden Reserve, as opposed to, let's say, servicemen and women serving on active duty who just serve honorably and then move on with their lives, who could be impacted by the subject matter here that we're talking about today, is there any data out there that suggests that is broken out by Garden Reserve when it comes to food insecurity? Because for those of us who've served in the Garden Reserve, you really don't move your family, when you get activated and deployed, and when your activation, your mobilization is complete, then you, in most cases, will return home to your hometown, go back to whatever business you were in before, and then continue on in your Garden Reserve duty. So the stability of the home life, the family life of the Guardsmen or Reserve, in some cases many cases does not mirror that of men and women serving actively and then leave active service and find themselves at risk. Is there any data out there that suggests any correlation between
you know, the stability of home life at the Garden Reserve and active when it comes to this subject?
Thank you, Mr. Congressman, and I think your point is well taken in terms of those specific needs and issues. I would have to defer to the DoD on any data that they have been collecting. I do know that Feeding America has conducted some work and has been involved in collecting some of that data, but again, I would have to defer to them on any specific. But we do not have that.
No, thank you for your answer, because actually this is quite an opportunity for DoD, VA, USDA, whoever else to collaborate on the sharing of data as it relates to all men and women who serve in uniform, whether they be active, guard, reserve. You mentioned, Dr. O'Toole, about a tie between food insecurity and suicide risk. And you also have several, it's been stated from you and from up here that many of these veterans at risk are outside the VA healthcare system. Have you tried anything or considered anything that would allow different ways to reach the population outside the VA? I know I heard podcast, but that's only if that veteran is not connected to the internet and is in a rural or remote area. Any different things that you have tried yet, whether be successful or not?
Thank you for the question, Mr. Congressman. I think it's important as we think about food insecurity to also realize that oftentimes it's not occurring in isolation. And so, as I mentioned, some of the suicide prevention initiatives and efforts of reaching out to the community are one example for how we can be tapping into that population and trying to reach out and engage in a community way. Other efforts within VA include our homeless outreach to not only veterans, men and women who served, who are homeless, but also those who are at risk of homelessness through SSVF programming, through stand downs and such. And I think the convergence of these issues and needs within those outreach efforts do provide us an opportunity. You know, is there more we can do? Absolutely. And I think it will always be a challenge for us because there's a lot of people who choose not to go to the VA despite services and capacities that are there. But I think these are some of several efforts across different population group needs that I think provide opportunities for us.
Well, I guess, and you can take this for the record, but what help can we, as Veterans Affairs Committee, give to VA in this case to enable that outreach that is not currently occurring because people are outside the system? What help can we give you as VA to complete that outreach to those veterans who are outside the system? And with that, Mr. Chairman, I yield back.
Thank you, Mr. Bergman. I'd now like to recognize Ms. Lee for 5 minutes.
Thank you, Mr. Chairman, and thank you all for being here. This is such an important issue for our veterans. You know, I also sit on the Education and Labor Committee, and a few weeks ago we conducted oversight hearing on the Department of Agriculture's proposed SNAP rule that eliminates broad-based categorical eligibility. And the finding was that it eliminates access for about 1 million school children to free and reduced lunch, and incredibly frustrating to be on the committee with this rule that the department did not include that impact in its initial regulatory impact analysis. And then after it did publish the analysis showing this effect, it continued to pursue the rule. And so that's just I just wanted to point out that frustration. And then in my home state of Nevada, 17,000 veterans receive SNAP benefits, and we know that low-income veterans may be unemployed, working low-wage jobs, or have disability, and SNAP provides such an essential support that enables them to purchase food for their families. So, you know, given this pattern, I just want to raise a question about the USDA's priorities. Why has the USDA prioritized regulatory actions that would reduce state flexibilities, limit access to SNAP, and increase food insecurity, rather than actions that would be more proactive and responsive?
Thank you for the question. Our goal with these proposed regulations and the final rule is to align the program with the statute. The statute is very clear in setting income limits as well as asset limits for who should be receiving SNAP. And so we are trying to align the program with the statute and make sure that participants are treated fairly and consistently across the country. Because we know that folks in California are being determined eligible very differently than folks who are living in Virginia, for example. And so what we're trying to do is really make sure that everyone's on a level playing field. Regardless of which state you live in, SNAP participants should know the expectations of how they should apply and what the requirements are, because the statute, defines that for us. And so we are trying to align the program with the statute and make sure that everyone's treated fairly and consistently.
So basically, it's our duty to change the statute if we want to see additional eligibility.
Yes, ma'am. Congress has that ability to do so. And so we're happy to always work with you all, provide technical assistance if there are any legislative proposals you'd like to pursue.
One question I have, so we know that there's millions of Americans who are experiencing food insecurity, including veterans, and are eligible for SNAP, but they don't receive the benefits. How is the USDA addressing that SNAP participation gap?
We want to make sure that our program does reach those who are in need and those who qualify and are eligible for the program. States have the ability, and they do some outreach and making sure that they work with different partners, whether it be through other federal agencies, like our collaboration has been with the VA, and making sure that we've provided some training to their caseworkers, and so that they know some of those requirements. And so I think there's some outreach opportunities at the state level and working with some of our other federal partners.
So the USDA is not taking any ownership of that. It's really through those partnerships.
The law prohibits us from doing direct outreach for SNAP as part of the 2014 Farm Bill.
Dr. O'Toole, I wanted to thank you for coming in today and your work with the Veteran Food Security Workgroup. I'm particularly concerned, given the findings of the 2013 study, that vets with food insecurity tend to be younger, not married, earning lower incomes at a lower military pay scale. So I can't help but be concerned about student vets. I wanted to ask you, you listed numerous actions being taken by the VA identifying veterans who experience food insecurity, and I applaud that. What can we do to capture student veteran hunger?
Thank you, Congresswoman. The population groups you mentioned are all very vulnerable, and part of that vulnerability comes from the many challenges they experience as they transition from military to civilian life, oftentimes with, while still bearing the scars of battle and many of the challenges that are associated with that, whether it's PTSD or other conditions and challenges. And so being able to enter into gainful employment, being able to fully engage are clearly an issue. I think obviously the role of student veterans and the dynamics that they are struggling with and shortfalls that may occur in their capacity to sustain a household are equally pronounced. I would have to take for the record specific plans and actions that we may be able to do specific to that population group, but I appreciate you bringing it up.
Thank you. My time's expired. Thank you.
Thank you, Ms. Lee. I'd now like to recognize my friend, Mr. Barr, for 5 minutes.
Thank you, Mr. Chairman. And I want to thank Chairman Levin and Ranking Member Bilirakis for holding this important hearing and addressing this important issue of food insecurity among our veterans. And I particularly appreciate my friend, Mr. Levin, for his passion, because we talked about this before the hearing today, and I know he's very passionate about it. And we all care very, very deeply, especially when we find homeless veterans in our communities, folks who interact with the VA and veterans who don't interact with the VA who struggle with food insecurity. And Dr. O'Toole, I was obviously moved by your testimony that when you said that the VA's food insecurity screening tool found that over the last 2 years, 1.5% of all veterans are screening positive for food insecurity. And I just think, wow, what about those veterans who don't even get the screening? You've got additional food insecurity there. My view is that for a veteran that is not disabled, especially a veteran who's not disabled without and doesn't have dependents, the best thing we can do for that veteran is to get them a good job. A job that's a win for that veteran, obviously, because it addresses that issue of food insecurity and shelter insecurity and everything else. But it's great for the employer because these are heroes to our country and they've got great skills to offer these employers. And, you know, let's face it, the economy is doing really, really well right now. And we have 1 million more job openings in this country than we have unemployed people. What if we could fill those job openings with veterans? That's what we need to do. That's what we got to focus on doing. So I want to talk about what the USDA is doing to try to encourage work among not just our veterans but others, and getting folks back into the labor market. So let me ask my first question to Ms. Miller with respect to this able-bodied adults without dependents rule. Why does the USDA believe that the criteria for state waivers from the congressionally mandated SNAP work requirements need to be changed?
Thank you, Congressman. And as you just commented, it's really focused on the fact that we do have a very robust economy right now, and there are more job openings available than there are job seekers. And so this seems like a perfect environment where we should be engaging this population and helping them move into work and getting the skills that they need. And so we have programs such as our SNAP Employment and Training Program. States are required to run those programs. We do provide them with formula funding, as well as we have the opportunity to provide matching funds as they continue to expand and grow their employment and training programs to help SNAP participants, these able-bodied adults without dependents, get the job skills that they need.
And let's go back, Ms. Miller, to your testimony about it's Congress's job to change the statutory requirements if needed. I for one, don't want to change the statutory requirements. I think the waivers have actually impeded people from getting back in the workforce. And so let's just go back to the statute that was a bipartisan statute. Let's just examine that for a minute. The statute limits participation by adults 18 to 49. So we're not talking about seniors. We're not talking about anybody younger than 18. We're talking about a prime age worker, 18 to 49, without a dependent and without a disability. So we're not talking about veterans with disabilities here. We're talking about non-disabled, no dependent veterans between the ages of 18 and 49, prime working years, okay? And there's a time limit, 36 months for SNAP, unless the individual is working or participating in a work program for at least 80 hours per month. That's 20 hours a week. Or volunteering. They can volunteer. They don't even have to work. They just have to volunteer, do something that gets them work capable. Am I describing the underlying statute correctly?
Yes, sir. Everything you said is correct.
So I don't think it's stingy. I don't think the statute is stingy. I think the statute actually creates great positive incentives for able-bodied, work-capable, no dependents, prime-age workers to do something to get them back into a productive place where they can be self-sufficient. When we're talking about food insecurity, to me, that's exactly what we need to be promoting. So to the extent that states are impeding that incentive structure, I think that does a great disservice to these heroes to our country and encouraging them to be more dependent than independent. One final question, Ms. Miller. In Maison's testimony, they tell a story of a Navy veteran in Maine. The veteran's benefits for SNAP were not extended even though the Department of Labor ruled him unable to work. Would the proposed rule change for state waivers impact people in similar situations?
That is an unfortunate situation, and so the states have the responsibility to be sure they are properly screening individuals for their fitness for work. And so we can, if there are situations like that, we can certainly work with the states to provide technical assistance, because if he did have information from Department of Labor, that would satisfy those requirements of having that individual not be subject to the final rule that we're talking about.
Okay, thank you. I yield back.
Thank you, Mr. Barr. Appreciate your comments and working with you on this issue on a bipartisan basis. Now I'd like to recognize Ms. Rice for 5 minutes.
Thank you, Mr. Chairman. I don't have a question. I just have a comment. I can't believe that we are sitting here talking about this. We should all be humiliated that we are talking about taking food away from any man or woman, however able-bodied they may be, who wore the uniform of this country. We must strive to build communities that truly serve, support, and protect our veterans from the very first moment they return to civilian life. I didn't say that. Those are the words of President Trump. For him to allow you to implement a ban like this, basically, to take food out of the mouths of a veteran, is nothing short of un-American and inhumane. I can't even believe we're sitting here talking about this. I can't, and you're sitting here and you're talking about, you're using terms like level playing field when you're talking about taking food away from people. This is disgusting. And we're sitting up here saying, what can we do? I think we all know what we can do, and we should just do it so we don't have to hear people like you talking about level playing fields when you're talking about men and women who wore the uniform of this country not being able to get food. Thank you, Mr. Chairman.
Thank you, Ms. Rice. I'd now like to recognize Mr. Muser for 5 minutes.
Thank you, Mr. Chairman. Thank you all. Clearly a difficult issue, one in which I think we all agree in the end, anyone who cannot afford to maintain a level of nutrition and food, we, particularly a veteran, we as a country, we as communities engage in. I myself donate regularly to food banks, and there are quite a few of them. That's for sure. There are some food banks that exist for the purpose of veterans. I have one in my district known as the Keystone Food Bank. So what we need to figure out is how to get it done, right? In a way that's accountable. I have the Lebanon VA in my district. It takes a very holistic view of veteran services. So they work with many community organizations to connect whenever they feel that there's benefits that aren't in line with the best interests of the veteran and the deserving. So is that a best practice that's encouraged or modeled or taught for other VAs to really take this holistic approach, ask the questions, not just look at the data of what their income levels are?
Thank you, Congressman, for that question. And I think it highlights both an important point and really underscores what we view in the VA as our mission. And we see our role and job as going far beyond just making sure that we're managing a health condition or a health problem, but really trying to take care of the entire veteran. And that extends through many examples, and I would wholeheartedly concur with the great work that's being done at the Lebanon VA and the leadership there and the staff there and their commitment to those men and women who served. But it's a great testimony and example of what we are trying to do. And it gets back to the larger issue in the context of food insecurity, that we have to look at food insecurity not only in isolation, but what are the root causes to it, and work with the veteran and support the veteran through that context of helping them secure, in addition, stable housing, stable employment, addressing domestic violence issues, providing the supports that they need so they can support their families. And that goes far beyond a prescription pad. So I appreciate you bringing it up, and that is very much our commitment. And it's also the strategic approach that we have taken to the food insecurity screener and the interdisciplinary and team-based approach to trying to address what's a much deeper problem than just food.
Yeah. And I also just want to, for my next question, commend the Department of Veterans Affairs, particularly over the last 2 years, the Mission Act, the Veterans Choice Act, have been implemented on a bipartisan basis, but very much led by Secretary Wilkie and your staff. Most of you are veterans, and if not, you are dedicated your lives, more or less, your working lives, to serving veterans. And I see that throughout the Veterans Administration, and it's appreciated. Not as only is it appreciated by me, since I have 55,000 veterans in my district, it's appreciated by the veterans and their families. They have seen improvements, not just from the Lebanon VA, but the VA as a whole. You know, it wasn't too long ago, a couple of years ago, 3-4 years ago, that all we saw were disasters within various veterans administrations. But the work that's been done, we're caring for our veterans better now. Is there work to do? Absolutely. Such things as the Improve Act that we need to pass and provide more community services, so as we have the hybrid approach towards the best possible care for our veterans. And so I really commend you for your work and your dedication, and thank you for your service. The other thing I wanted to ask you, the USDA, who's very active in my district, and the Department of Veterans Affairs, do they work in unison? Is there cooperative efforts there in this regard related to food?
Yes, sir, there is. And we work closely. We have had some training programs with some of the veterans VA caseworkers so that they are familiar with our programs and helping connect vets to our programs.
All right, great. I yield back, Mr. Chairman. Thank you.
Thank you, Mr. Muser. With that, I'd like to thank our first panel. And I'd now like to call up our second panel. And while everyone is switching around, we'll take just a minute. All right. Thank you, everybody. On the second panel today, we have Josh Protas, Vice President of Public Policy at Mazone, a Jewish response to hunger. Thank you for being here. Also joining us is Denise Hollywood, Chief Community and Programs Officer at Blue Star Families. And finally, we have Vince Hall, the CEO of Feeding San Diego. Thank you all so much for joining us. I'm looking forward to getting your perspective. As you know, we'll have 5 minutes for your oral statement, but your full written statement will be added to the record. Ms. Protas, you're now recognized for 5 minutes. Or Mr. Protas, excuse me. And please use the microphone.
Thank you. Chairman Levin, Ranking Member Bilirakis, and distinguished members of the committee, thank you for the opportunity to testify today. My name is Josh Protas, and I'm proud to serve as Vice President of Public Policy for Mazone, a Jewish response to hunger. Inspired by Jewish values and ideals, Mazone takes to heart the responsibility to care for the most vulnerable in our midst, without judgment or precondition. For nearly 10 years, we have prioritized addressing the long overlooked issue of hunger among veterans and military families. The Supplemental Nutrition Assistance Program, or SNAP, is the most crucial tool in supporting veterans who struggle to put food on the table. Unfortunately, it's under attack through administrative actions that will increase hunger and hardship for struggling veterans. I'd like to tell you about one of these individuals, Tim Heath, a Navy veteran in Maine. I spoke with Tim last week, and he agreed to allow me to share his very painful experience. After being injured, Tim couldn't return to work and fell on hard times. He applied for SNAP so that he could afford to buy food. Because the state of Maine chose not to waive the time limit for able-bodied adults without dependents, or ABODs, Tim lost SNAP benefits after only 3 months. And 3 months is the limit, not 36. He repeatedly asked to the numerous officials who passed him along in the bureaucratic maze, "What do I eat between now and then?" Nobody had an answer for Tim. Without SNAP, Tim had no assistance and became homeless. He resorted to scrounging for food and even catching squirrels to eat to get by. Reflecting on his time, Tim shared, quote, "There were many times when I would go 2 or even 3 days without food. The food bank has only limited resources. I had to add 7 holes on my belt to keep my pants on." For people like Tim, SNAP can literally save lives. We know that SNAP helps about 1.3 million low-income veterans, but a recent report suggests that nearly 2/3 of veterans who struggle with hunger and are eligible for SNAP are not currently enrolled. Nobody, and certainly no veteran like Tim, should ever be forced to ask, "What do I eat?" because they can't get the help they need from the country they fought to protect. Mazon urges Congress to 1, protect and improve SNAP. USDA must withdraw the 3 harmful proposals that would strip SNAP benefits from millions of Americans, including veterans. Of particular concern is the rule that would restrict waivers from current SNAP time limits. This rule is not nuanced, it's not flexible, it is not a reflection of the realities of struggling Americans. It is entirely inappropriate for USDA to move forward with changes to SNAP without understanding how they will impact America's veterans. Food insecurity can often trigger a downward spiral of economic hardship and despair, which unfortunately can lead to suicide. Improving access to SNAP for struggling veterans is an important tool in the campaign to end veteran suicide and needs to be prioritized. 2, connect veterans to SNAP. We are pleased that the VA took Mazon's advice in 2015 to start screening veterans for food insecurity, but the current process isn't doing enough and doesn't capture all veterans who struggle. VA must adopt a validated 2-question hunger vital signs screening tool to more accurately identify all veterans who are at risk of food insecurity. And for veterans who screen positive, VA should require and provide on-site SNAP eligibility and application assistance, which is not happening broadly. 3, share nutrition assistance information during transition. VA should integrate materials about programs like SNAP as part of the Transition Assistance Program and other veteran outreach efforts. Include this information as part of the new Solid Start Veteran Suicide Prevention Initiative, and work with USDA and community partners like Mazon to develop veteran-specific resources about SNAP. 4, listen to veterans. Negative public perceptions of SNAP are ramped up by proposals to restrict the program for only certain Americans. This creates a chilling effect and adds to the stigma and shame that make veterans and others reluctant to seek help that they need. This committee should hold a follow-up hearing to listen to veterans who have real lived experiences with food insecurity. Lastly, Congress must address the related issue of hunger among currently serving military families that has been ignored for far too long. Mazon believes this is an urgent matter of national security, military readiness, retention, and recruitment. The best way we can support and honor the veterans is to ensure that they have what they need and never have to struggle with hunger. For someone like Tim, that means ensuring access to SNAP. When Tim turned 50, the state's SNAP time limit no longer applied, and he was able once again to get the assistance he so desperately needed. Tim is in a much better place now. He wants to make sure that others, veterans and non-veterans alike, do not fall through the cracks like he did. Thank you. I look forward to your questions.
Thank you. Appreciate that. And I'd now like to recognize Ms. Hollywood for her opening statement.
Mr. Chairman, Ranking Member, and distinguished members of the subcommittee, thank you for the opportunity to testify before you today. My name is Denise Hollywood, and I am the Chief Community and Programs Officer at Blue Star Families. Blue Star Families builds communities that support military families by connecting research and data to programs and solutions. Since its inception in 2009, we have engaged tens of thousands of volunteers and served more than 1.5 million military family members. Blue Star Families is nationally recognized for our annual Military Family Lifestyle Survey, which uses both quantitative and qualitative data to reveal a snapshot of the current status of military families. In our 2018 survey of over 10,000 respondents, we found that 7% of military family respondents and 12% of veteran family respondents indicated that someone in their household had faced food insecurity in the past year. Additionally, 9% of military family respondents and 18% of veteran family respondents indicated that someone in their household had sought emergency food assistance through a food bank, food pantry, or charitable organization. In order to comprehend the issue of food insecurity among veteran families, we must first understand the factors that contribute to food insecurity while these families are still actively serving in the military. Such factors include high rates of military spouse unemployment and underemployment, limited availability and high costs of childcare, out-of-pocket relocation and housing expenses, and unexpected financial emergencies. Many of these factors arise from frequent relocation due to military orders. According to the Department of Defense, active duty military families relocate on average once every 2 to 3 years, typically across state lines or overseas. Frequent relocation makes it difficult for military spouses to find and maintain gainful employment, partly because employers are wary of hiring individuals who have gaps in their resumes as a result of previous moves. If a military spouse works in a licensed profession, he or she must also undergo the costly process of relicensing in a new state. In 2018, we found that 30% of military spouse respondents were unemployed. This figure dwarfs the civilian unemployment rate, which in 2018 was less than 4%. 56% of military spouse respondents who would have liked to be employed cited childcare as a reason for why they were not currently working. Meanwhile, 70% of millennial military family respondents reported that having 2 incomes was vital to their family's well-being. Thus, the military spouse employment crisis directly contributes to food insecurity by preventing military families from achieving a vital second source of income. The financial difficulties of modern military families are further compounded by frequent out-of-pocket relocation expenses. Although the federal government covers the majority of the expenses incurred due to relocation, 1/3 of respondents reported spending over $1,000 in unreimbursed expenses during their last military move. All of these factors, out-of-pocket expenses, rising costs of childcare, spouse unemployment, and others, can contribute to food insecurity among currently serving military families. Food insecurity among active duty military families does not end when service members retire. To the contrary, the financial difficulties of military families can be aggravated by transition-related challenges. It is critical that we work to address the underlying causes of military and veteran family food insecurity. At the same time, however, this committee can take immediate steps to address veteran hunger by protecting and strengthening programs like SNAP that alleviate veteran hunger, instructing the VA and USDA to be more proactive in their efforts to identify veterans who are experiencing food insecurity, and establishing VA partnerships with nonprofits to help reach veterans who are not receiving services through the VA network. The federal government must also work to expand its data collection around military and veteran family food insecurity so as to better inform policy responses to these issues. Blue Star Families is well situated to help in this endeavor. I would like to again thank the distinguished members of the subcommittee for their efforts to eliminate military and veteran hunger. Those who make significant sacrifices for our country should never struggle to put food on the table. Thank you.
Thank you, Ms. Hollywood. Now I'd like to recognize Mr. Hall for 5 minutes, and thank you for all your good work in my neck of the woods out in North County, San Diego.
Well, Chairman Levin, thank you so much. Ranking Member Bilirakis and distinguished members of the committee, my name is Vince Hall. I'm the CEO of Feeding San Diego, which is a leading hunger relief and food rescue organization in San Diego County. We are also a very proud member of the Feeding America network. For perspective, San Diego County is 4,500 square miles, has a population of 3.4 million people, making it larger than 20 U.S. states. It has one of the largest concentrations of veterans and military personnel in the world. Our Navy, Marine, Coast Guard bases, and National Guard armories are a critical part of this nation's national defense infrastructure. Our county is home to 143,000 active duty military, 260,000 military dependents, 243,000 veterans, and 583,000 family members of veterans. Over 1.2 million San Diegans, 37% of our population have direct ties to the military. It is a proud heritage, but it comes with solemn responsibilities. Greatest among these responsibilities is to ensure that our veteran and military families have a dignified quality of life that honors their sacrifices. But all too often, despite the efforts of our government, it falls to organizations like Feeding San Diego and Feeding America to close this significant gap between what our heroes have and what they need to provide for their families. I am proud of my organization, but I take no pride in the fact that our country stations people in San Diego without paying them enough to live in San Diego. And I take no pride in seeing ever larger numbers of veterans lining up at our Feeding Heroes food pantries every year. Now, the good news is that Feeding San Diego has innovative food rescue approaches to delivering healthy, fresh, and nutritious food that would otherwise go to waste. Last year, we rescued 24 million pounds of food that was going to leave the food system and go to the waste system from stores, farms, manufacturers, and other sources. With our faith-based and charitable partners across the county, we distributed 26 million meals worth of food, 97% of which was rescued food that otherwise would have gone to a landfill. According to the USDA, 40% of the food in this country goes to waste every day. That's more than enough to solve hunger for every man, woman, and child in need. Through our partnership with Feeding America, we rescue food in San Diego County from 200 Starbucks stores every night of the year, 260 grocery stores, 19 school district central kitchens, and dozens of other sources. We also rescue fresh produce from 225 farms and packing sheds up and down the state of California through our partnership with the California Association of Food Banks. But we couldn't do this by ourselves. We are proud to partner with 170 religious and charitable organizations across the county who work hand in hand with us to implement this innovative model. Many of these organizations are specifically focused on the needs of veterans and active duty military families. Groups like the USO, Us for Warriors, Courage to Call, Military Outreach Ministries, and Support the Enlisted Project. Our distributions reach families through a dignified farmers market style model, which allows individuals to select the foods that are best for their family's needs. Our military can access fresh, nutritious fruits and vegetables without stigma or unnecessary bureaucracy through these pantries. But as strong as our efforts are, there is much more to be done, and there are serious threats to our progress. We are asking Congress to do several things which would help us to finally solve veteran and military family hunger. Foremost among these is to oppose cuts to the SNAP program, which threaten millions of Americans, including many of the veteran and active duty military families that we serve. Feeding America is 200 food banks strong, but for every one meal that is provided by our entire network, the SNAP program provides 9 meals. So even a relatively small cut to the SNAP program threatens to create a staggering increase in demand at America's food banks, a demand that we simply cannot meet. I also encourage Congress to include needed improvements in child nutrition reauthorization, which will help to increase food access for the children of military and veteran families. I want to end my testimony by sharing Desiree's story. Desiree participates in our Feeding Heroes program. Her husband is a communications officer in the Navy who makes just over $34,000 per year. She has 4 kids, and her husband has been deployed now for nearly 8 months. She told us that she knew life as a military spouse was going to have its challenges, but she never expected that one of those challenges would be feeding her own children. Thousands of military families face similar challenges. We see too many kids standing in food lines while their parents are serving on the front lines. It has been an honor to testify today on behalf of everyone we serve at Feeding San Diego, including Desiree and her family. Thank you.
Thank you so much, Mr. Hall, for your leadership and your work in San Diego. I'm glad this has provided an opportunity to highlight some of the great work you're doing. And really, for all 3 of you, thank you as non-governmental leaders and experts for bringing your perspective today. I want to thank the VA representatives for sticking around to hear them. Is anyone from USDA still here? Let the record, yes, someone is from USDA still here? No. Let the record reflect that no one from the United States Department of Agriculture who administers the SNAP program took the time to stay to listen to non-governmental organization experts who see firsthand in the field how food insecurity is impacting the veteran community. Let the record reflect that. With now, I'd like to turn to some questions. Mr. Hall, I was really delighted to join you recently to tour your distribution center. And I enjoyed learning about all the good work that you're doing and how you do it. Are most veterans that you see that are referred to Feeding San Diego, do they get there from VA or from elsewhere? And can you comment on any stigma or any reluctance to seek assistance among food insecure veterans?
Thank you, Mr. Chairman. The referral system is very informal, and it often happens through peer networks. We have different groups of veterans that we serve. Transitioning veterans who have just left the service, or perhaps as long as 5 or 10 years, they're still trying to find their footing in civilian life, find us through support organizations that they turn to shortly after their discharge from active duty. Senior veterans might come to us through neighborhood-based senior programs, and it's only as we begin to serve them that we learn that they are veterans who might be eligible for VA benefits and services. And a lot of just person-to-person referrals cause people to find their way to our food pantries. Even the VA Medical Center in San Diego consistently refers people to Feeding San Diego for hunger relief services. But you hit on a key point, Mr. Chairman, and that is stigma, that no one who has worn the uniform of the country feels pride in accessing food through hunger relief charities. It is really our duty, our obligation morally to support those who have served this country to ensure that they don't need to turn to charitable organizations to have a minimal quality of life after they themselves have put their life on the line for this country. So only by partnering with these organizations that have the trust of veterans do we find it that we're able to create safe environments where we minimize that stigma and maximize their dignity, but it is still always an ever-present challenge.
Thank you for that. Mr. Protas, you noted in your testimony that VA's current screening tool of a single question only identifies veterans at risk of very low food security. Can you explain the difference between very low and low food security and why it's important to identify and address both?
Sure. Thank you for the question. The difference is really a technical difference in the way that USDA defines the two. Low food security is defined as households with that have reduced the quality, variety, and desirability of their diets, but the quantity of food intake and normal eating patterns were not substantially disrupted. And very low food insecurity describes that at times during the year, eating patterns of one or more household members were disrupted and food intake reduced because the household lacked money or other resources for food. The truth is both of those categories are considered food insecure, and that people have to alter their eating habits, which ultimately results in poorer nutrition and poorer health outcomes. The single question that's being asked, we think, captures really just those who experience very low food insecurity, and the rate, it's under 2% that they're determining. We know that the rates for certain parts of the veteran population and veterans in general are much higher than that, so many people are falling through the cracks.
Thank you for that. For both you and Mr. Hall, by USDA's own admission, its recent proposed rule changes to SNAP will lead to significant reductions in SNAP participation, which will no doubt include loss of SNAP benefits for struggling veterans, although, as I'm sure you remember from our first panel, they don't know how many, although they promised to get us that number, though they're not here anymore to hear this. Mr. Hall is an organization that provides both direct food and also enrolls individuals in SNAP. What impact do you think these changes are going to have for your organization, for Feeding San Diego? Do you and other food banks and pantries across the country, do you have the capacity to make up for these cuts while also maintaining the robust emergency response that you provide to the San Diego community?
Thank you, Mr. Chairman. The short answer to the question is no, we do not have that capacity. It is so complicated to get somebody enrolled in SNAP under the current eligibility criteria that we've had to redirect our staff resources to not just helping people apply for SNAP, but instead doing fewer applications and helping more people through the entirety of the documentation process to get them to the finish line where they can receive SNAP benefits. So we've actually scaled back our enrollment process to meet the complex bureaucracy that surrounds the existing SNAP program. This is going to add an entirely new layer of complication, which we cannot afford to support.
Thank you. And Mr. Protas, what does the experience in Maine that you highlighted in your testimony teach about the ability for hunger relief organizations to mitigate the impact to veterans from SNAP policy changes?
Sure, thank you for the question. In 2015, then Governor LePage, the governor of Maine, chose not to take state waivers for the time limits on SNAP, even though the state was eligible for those waivers. And the state saw an increase in hunger that resulted. Thousands of Mainers, including about 2,800 veterans, lost access to SNAP. It didn't mean that they had a bettering of their life circumstances. It didn't mean that because they lost the $1.40 per person per meal benefit that they were inspired to get work. I think the shared goal is to get people back to work who can, but just taking food away from people doesn't magically make them work. And that was the case that happened in Maine. The story from Tim that I shared was a very personal story of somebody who was hurt, but we know that there were thousands of other veterans and tens of thousands of other Mainers who lost access to SNAP and went hungry as a result of that change.
Thank you very much. And with that, I'd like to turn it over to the ranking member, Mr. Bilirakis.
Thank you. Appreciate it very much. Mr. Chairman, I understand that the statute, and I agree with you, USDA should be here. They should have stayed. But I understand they're barred by statute. They can't request the veteran status. And I'd like to discuss that with you because we got to give them that authority to do so. So I would appreciate that. I understand it was taken out in the Farm Bill, that authority. So let's get that done together. Going down the panel, and I guess we'll start with Mr. Protas. Is that okay? Would you support an increase in the federal government's ability to require states to track the veteran status of SNAP beneficiaries? And if not, why? Why not?
I think I would support that. I think USDA has ways to collect information right now that they're not. The estimates about the 1.3 million veterans who participate in SNAP currently comes from Census Bureau data from the American Community Survey. So there are ways to get this data and to get information. I think it would be fine to inquire about veteran status, but that shouldn't be the barrier to USDA in doing more to examine this problem.
Okay, and I do want to commend all the groups for all your good work in helping our heroes. I really appreciate it so much, and we respect you tremendously. Again, the question for Mr. Protas and Mr. Hall, feeding San Diego. Do you believe that SNAP should be a temporary assistance program? Mr. Protas first.
I think for the vast majority of SNAP participants, SNAP is temporary assistance and it works the way it was designed. But there are some individuals, those who are disabled, those who are not able to work, where it may provide longer term support. Ideally, people get back to work in that SNAP is a stepping stone. But if they don't have jobs in their communities and there aren't job training opportunities, it's difficult. And there are many barriers people face to work. Ms. Miller talked about employment and training programs, and I think that's really important. We saw in the last Farm Bill that there were 10 pilot programs for employment and training programs, and we should see what works out of those. We should see the results of those employment and training programs. But the truth is there aren't job training slots for every SNAP recipient who wants to better their skills to get work. So if we really want to get people back to work, which I think is a shared goal, let's invest in those employment and training programs so that SNAP is a temporary assistance. But just taking food away from people isn't the motivator that's all of a sudden going to have somebody then seek work. They're looking for work. They just don't have jobs or don't have training opportunities in their communities, or they face barriers to work like transportation or childcare.
All right, thank you. Mr. Hall, again, do you believe that SNAP should be a temporary assistance program?
I agree with the previous response that for people with permanent disabilities, with seniors, with people who don't have a path to self-sufficiency, SNAP is an important part of meeting their monthly nutritional needs. However, I also would say that we have a program where the data in San Diego tracks the national average, that the average SNAP person and participant is within the program for less than a year. It is a successful program that is lifting people out of poverty, and when we look at the numbers of SNAP recipients who aren't working, it's typically not the same people each month. That is, that this is a program that fluctuates and new people find themselves in crisis and people find their way back into the workforce and then they're no longer in the program. So I think the program is functioning well and it's serving its intended purpose.
Okay. Question for Mr. Protas. And Ms. Hollywood, anytime you want to chime in, please don't hesitate. I want to give you an opportunity first. Let's do that. Do you have any questions? I mean, do you want to add to that in any way? Okay, all right. Mr. Protas, in your written statement, you provide the story of Tim, a veteran, a hero from Maine. Why was the Department of Labor, the determination not enough for him to qualify for SNAP?
I think there was some misunderstanding between state agencies, and unfortunately, we know that there is a lot of confusion about disability status. In fact, Ms. Miller noted in her testimony that veterans who receive full disability rating are exempted from work requirements. That's actually not the case. Of any veteran who has a disability rating and receives any benefit at all from the VA is exempted from work requirements. And we have the head of the Food and Nutrition Service who did not properly convey that and understand those regulations. So I think there's a lot of confusion, and better information needs to be distributed, and USDA has a role to play, but then state agencies that administer SNAP and other safety net programs have to play a role as well. And I think the VA can play a part in better communicating those guidelines so people don't fall through the cracks like Tim.
I just want to emphasize that all of us want our veterans, obviously, and their families to have food security. It's just a matter of, I think we need, more hearings. And as the chairman told me, he'd like to have a panel of veterans to get their input on this. So I really appreciate your input, your testimony, both panels today, and I yield back. Thank you.
Thank you, Mr. Ranking Member. And yes, I agree with your suggestion as part of your testimony that we should be hearing from veterans themselves. So we'd absolutely love to do that. And in addition, I'd appreciate the chance to work with the Ranking Member to get the data to know exactly how many veterans are being impacted by this. And in fact, there are reasons why USDA or VA cannot work together to provide that information. We need to understand that as well. And we did at least get, while the USDA administrator was here, the commitment that she would work with VA to try to get that data to us. So we'll keep at it, and it is going to take more hearings, and I look forward to working with you together on that. With that, I'd like to recognize Mr. Pappas for 5 minutes.
Thank you, Mr. Chairman. I'd like to second that recommendation that we continue to look for ways to listen to the veterans, and I appreciate the way that this panel has brought out some personal stories of how veterans have been impacted by food insecurity and economic hardship. And if there's an opportunity for a roundtable or some way to pull together a forum, Mr. Chairman, I would absolutely love to participate in that. I appreciate your comments here today, the work you do on behalf of veterans and those who are struggling across our country. We all know, and we heard in the last panel, that 36 million Americans rely on food stamp benefits in this country every month. And that's at a time when we consider that the economy is doing well. 1.3 million veterans accessed the SNAP program, according to recent data. And we've got to make sure that those vets continue to find ways to be connected, even as this administration seeks to pull the rug out from under those who are struggling, who rely on the SNAP program. And I think it's outrageous that they've moved forward with these draconian measures that target folks who are struggling and who are really living day to day. Mr. Hall, you said a few things that I hear a lot from food pantries, from the food bank, from charities across my district that understand that even at a time of significant economic growth for many in our country, that there are those who are struggling, and that the SNAP program doesn't necessarily meet the needs of those who are food insecure. So I'm wondering if you could just continue to talk a little bit about what changes to this program mean for organizations like yours that are already stretched to the max, and why we need to make sure that we're doing all we can to fill in those gaps.
Thank you, Congressman. It is a very difficult challenge to convey how the SNAP program works in the real world. There's the complexities of finding eligible populations, and we know that only a percentage of eligible veterans in this country are participating in the SNAP program. We know that the documentation requirements that are required to successfully enroll, the lag time that's created before you receive a benefit card in many instances. In California, this is a county-administered program, and the County of San Diego is a terrific partner with Feeding San Diego and has a full-time employee in our food bank office to help us process SNAP applications. But often it can take weeks and weeks to help somebody who is in a crisis to get access to those SNAP benefits. We also see, sir, that the SNAP benefits often run out the second or third week of the month, and we see an increase in demand at food pantries from SNAP beneficiaries because the benefit amount is not enough to secure the quantity of food that they need to properly nourish their families. So it is a situation where the program works well within the guidelines that Congress has established for it, but Congress simply hasn't created the program in a way that's designed to solve hunger in this country. It is absolutely, at this moment, essential, critical supplemental aid for many, many veterans, and frankly, for many active duty military families. If I may just add, for active duty military families, having their basic allowance for housing counted as income for purposes of disqualifying them from SNAP is an absolutely inexcusable affront. And I know many of the members on both sides of the aisle agree on this, but I don't understand why we haven't fixed it yet.
Certainly no one's getting rich on the $4 to $5 a day average that SNAP pays for food assistance. And if anyone thinks that's an overly generous benefit, they should try living on it. I'm wondering if we could zero in on the fact that younger veterans of Iraq and Afghanistan in particular, are experiencing food insecurity at higher rates. Do you know why that's the case, and how can we do outreach to those communities to make sure that they're getting what they need?
So a recent study by researchers at the University of Minnesota found food insecurity rates about 27% for veterans who are returning from the wars in Iraq and Afghanistan. And these are astronomically high rates and very concerning. It was mentioned before about the economy that's booming. And I just want to say that the economy is not booming for everyone, that jobs aren't available in every community, especially in rural communities. And we also have many people who are transitioning from military service who are taking low-paying jobs and experience underemployment. Maybe it's a part-time job without benefits. Maybe they're cobbling together a couple of part-time jobs. And that underemployment rate was recently documented for recently returning veterans at a rate substantially higher than the civilian population. So I think that's part of the situation here. And we need to do a better job for those who are transitioning to make sure they're aware of the benefits that can help them during that temporary time of need.
And income invariability, I think, income variability too, I think is a key component here, because people go from getting a steady paycheck and on active duty, and then suddenly they're thrown into this crisis where they're, piecemealing various jobs together in order to get a solid paycheck. So
Sure. Thank you. I yield back.
Thank you, Mr. Pappas. I'd now like to recognize Mr. Bergman.
Thank you, Mr. Chairman. Thanks to all of you for being here, because what we're talking about, if especially the children of service members, if kids are hungry, they can't learn. Pure and simple. And when you think about the things we do in schools because the kids don't have food at home to eat, or when they go home on Friday afternoon for the weekend and we send backpacks full of food home with them because of their home life situation puts them at risk. So I thank you for what you're doing. Got a kind of a hodgepodge of questions here based upon the testimony that each of you gave. So, Mr. Portis, you used the example of Tim. Was he in the VA system?
He was not receiving health care in the VA system, no.
Okay, was that by choice?
I'm not sure that he qualified for medical care through VA. His disability wasn't a service-related disability. It was a job-related disability later, okay. So I'm not sure.
Okay, well, the reason I ask questions like that is because, data counts. And when we use examples of things, I want to make sure we do, because what we're trying to do here as the committee, doesn't make any difference which side of the aisle you're on, to understand what our role here as Congress is to do the right thing, in this case, for veterans and their families. For the whole panel, could each of you give a rough number, this doesn't have to be accurate, rough percentage breakdown of the veterans that you interact with who are inside or outside the VA system? Kind of like I just asked about Tim. 60-40, 70-30, what do you think?
I think it's maybe 60-40, 60 outside of the VA, 40 in.
Sir, our survey doesn't address that specific question. Our survey specifically, the data that we gather, approximately 85% of our respondents are military family members.
So they're active duty.
So active duty, and then the other 15% are family members, and then the other 15% are active duty and veterans.
Okay.
And sir, a significant portion of our Feeding Heroes program serves active duty military families. Within the veteran community, we don't have a mechanism to track how many are actively engaged with the VA versus are not. So unfortunately, I just don't have that data.
So what could and this is not a question to be answered here, but again, I really appreciate a response because active duty, Camp Pendleton, 32nd Street, Balboa Hospital, North Island, Coronado, okay? What could, again, for not to be answered now, unless you want to give you've got a quick solution you've already thought of. These men and women are stationed there. They're active duty, they're full-time. In most cases, or many cases, they're either living on board base or they're getting their BAH out in town, okay? And I'm guessing BAH is relative to the cost of living in San Diego. Okay, is there anything that these people they're full-time employees of the U.S. government. So take it out of the military, and let's say we moved all the Forest Service firefighters out there to be stationed temporarily in San Diego to be jumpers in the event we had forest fires, okay? Could they afford to live? Or is it just because of San Diego is a cost of living? By the way, first of all, let me compliment you on your talk about food waste and recapturing food, if you will. Are you familiar with Anthony Bourdain's 2017 Wasted, the Story of Food Waste?
Yes, sir.
That impacted me greatly when I first saw it. What saddened me is that we've got 8, soon to be 10 grandkids, and we're all now great-grandparents. So we're looking at now 3 generations down. What saddened me about that movie was it can't be shown in middle schools, or any school for that matter, because of the language in it. So if you could impact your fellow filmmakers out there, not that you're in the film business, to make it middle school presentable. Because the messaging we're talking about here is building resiliency. In the military, we have families who are committed to the country. It's our responsibility to be committed to them. But in building that resiliency within the family, within that service member, so the family can survive and thrive when the service member's gone to the fight. And I know I'm going over here a minute or so, Mr. Chairman, if you allow me to continue. But the idea is that when they leave active duty, they served honorably, they're end of active duty, and they're out in the civilian workforce. Can families, in your particular case, afford to live in San Diego? If they got out, if they served 4 or 8 years honorably, they got out at the E5 or E6 level or something like that. They don't have a pension because they didn't serve 20 years. What do you tell them?
It's increasingly hard, Congressman, to...
No, that's okay. It's okay here. That's accepted in this. You just can't say that in the Armed Services Committee.
Thank you, sir. It is increasingly difficult to understand San Diego's complex housing equation. Our cost of living is now about 40% higher than the national average. So it is unreasonable to expect that folks in the economic condition that you described are going to be able to easily locate, find housing, and support their families in San Diego. Unfortunately, our active duty military families don't get to make that choice. They're stationed in San Diego, and when their families arrive, the BAH is not sufficient to support them. So we have many families traveling from as far away as Riverside and Imperial counties to work.
I know the roadways very well, but San Diego has one problem because of your cost of living. San Francisco has probably a similar problem. Places like New York, Boston, D.C. have a similar problem to that as well. My district happens to be very rural and remote. We have a slightly different problem, usually the tyranny of distance and the availability of we need more, good paying jobs, but we're getting there because the economy is on fire in a positive way, not in a wildfire sort of way. But the point is, okay, if I see a hand coming up, Mr. Portis, when Mr. Portis is done answering, I'll yield back, sir.
Thank you, Mr. Bergman.
Sure, and just quickly, thank you for raising the issue about currently serving military families, and I agree with Mr. Hall that the basic allowance for housing is a barrier, and we've tried in the past, in the Farm Bill context, to have that basic allowance for housing excluded as income. But there's been an opportunity in the National Defense Authorization Act. We worked very closely with the National Military Family Association and Congresswoman Davis and Congressman Young for a bipartisan solution for a military family basic needs allowance. It would be an allowance to help junior enlisted personnel who have larger households who really struggle to make ends meet and don't qualify for SNAP even though they need it because the BAH is counted. So there's something that Congress can do. Congressman Levin's been a co-sponsor of that provision, and thank you very much. We'd love to see that taken care of in the next NDAA to make sure that those military families are taken care of. And as you mentioned too, the children in military families are a next generation issue. So when families today who are in the military are struggling, or even for veterans who have children, those children are much more likely to go into service themselves. And if they experience food insecurity as children, they're more likely to experience obesity and diet-related health conditions that may not make them fit to serve. And the Mission Readiness Organization of Retired Admirals and Generals has really prioritized this. So it's not only an issue for readiness now, but for recruitment down the road.
Thanks. And Mr. Bergman, I resemble the remark of living in a high-cost area. It's very true, but we're not going to solve all the reasons for that. Certainly, it's not the auspices of this discussion. I think this discussion is a fairly simple one, which is, are we going to allow veterans to go hungry? And I think the answer should be equally simple. We cannot allow veterans to go hungry. Not one veteran in need should go hungry, period. So with that, I'd like to recognize Mr. Barr.
Thank you again, Chairman Levin, for your leadership in holding this hearing, and I could not agree with you more. We shouldn't have a single veteran in this country food insecure, and I want to thank our second panel for your organizations, for your dedication, for your work in fighting this problem, and I've got to give a shout out to my food pantries back home in Kentucky, who I know serve many veterans. God's Pantry, Mr. Hall, you may know Michael Halligan. He does a great job, and it's a great organization. And there's a great network of food pantries within God's Pantry's network in central and eastern Kentucky. And Tamara Sandberg, who leads our whole statewide effort in this regard. I also want to compliment our agriculture commissioner back home in Kentucky, who's doing some innovative things to address food insecurity, Commissioner Ryan Quarles, and he's working very closely with our food pantry network back in Kentucky. Mr. Protis, I want to kind of explore a little bit more the conversation that you were having with Ranking Member Bilirakis about the temporary nature of SNAP. And obviously, I appreciate your comment that the temporary nature, and Mr. Hall as well, that the temporary nature of SNAP certainly is applicable to able-bodied, work-capable adults, but it obviously shouldn't necessarily apply to a senior citizen, someone who's disabled. I would just remind everybody that, of course, the underlying bipartisan statute doesn't apply. The work requirements don't apply to disabled individuals as far as I read it. So that's not, it doesn't appear to be an issue. But I do take seriously, Mr. Protis, your good point that in Maine, for example, and other places where there may be, in rural areas, I represent these exact places you're describing, in rural places where even in a booming economy, there is underemployment, there is difficulty in finding those 7 million job openings in those particular economic places. But as I read the proposed regulation from the USDA, it looks like they're taking that into account because it moves to a area-specific request for waivers rather than sweeping statewide waivers. I'd invite you to comment on that.
Sure. So one point about disability. Those who have recognized or properly recognized disabilities are exempted from work requirements, but many people fall through the cracks. And I think it would be wrong to discount that there are many people with mental health disabilities or physical disabilities that don't get fully recognized. And part of that may be because of economic barriers, because they can't afford to go to a doctor to get the proper documentation. There are many hoops that people have to jump through sometimes to get their disability properly certified. So,
and I think that's a fair point, and we should probably work together to address that. But when you're talking about a bona fide non-disabled person, you do agree that this should be a temporary program.
It should be a temporary program for those who are not able to work and who have opportunities available to them. And as far as the proposed rule change, states, it's limiting state flexibilities. And it wasn't just flexibilities about statewide waivers. There were area waivers that were currently exercised. So I don't know in Kentucky if you feel that USDA has a better sense about the job opportunities than your state officials. I think the way the 1996 welfare reform law worked is that there was a certain amount of flexibility for states to seek those waivers, knowing job opportunities in their communities, and they know best what's going to happen.
And I think that's a fair point. But as I read the proposed rulemaking, the move to area-specific requests for waivers makes sense because the states can apply for those in those pockets in rural Kentucky where we do have difficult labor market conditions. One other point that I read in the regulation that hasn't received a lot of attention, the proposed rule continues the use of exemptions for adults who are having difficulty entering the workforce. You are aware of that. I mean, that seems to me to address a lot of the concerns that you otherwise might have with the rule.
There's actually, there is a continuation of those exemptions. I believe in the proposed rule that there's an elimination of the carryover of exemptions. So that's a concern. It actually limits the number of exemptions. And I'm not aware that every state is fully taking advantage of those exemptions to waive. So my concern and Mazzone's concern is that it's limiting state flexibilities and it's limiting the options to help those who are really struggling.
Well, I really do appreciate your work and I appreciate your feedback on this. And certainly we'll continue to monitor USDA as it implements this because we obviously want these great organizations to continue to serve our veterans when there's a real need. And we also want them to encourage work where we can. So thank you very much. I yield back.
Thank you, Mr. Barr. Now I'd like to recognize Mr. Muser.
Thank you, Mr. Chairman. So we're, of course, the Veterans Affairs Committee here. Our focus is on veterans, not necessarily the entire population, although we care greatly about that as well. No veteran should go hungry. I think that that's understood. And we, whatever procedures and perhaps legislation or actions that need to be taken, we need to simply do a better job in assuring that occurs. Now, related to your organizations, and I stated earlier that I'm very familiar with various food banks, very often the community has to step up and you need capital campaign fundraising events and things of that nature, and other government participation. But we are, to an extent, talking about a broader issue here, and that's SNAP. And the thing is that if you look back at the data on the average participant and the population of those that receive SNAP benefits over the years, something doesn't add up. And what I mean by that is this. Go back to 1992. There was a recession. So there were 25 million people on SNAP. As the economy improved, as you would expect, the number of people receiving the supplemental nutritional program reduced by quite a bit, went down to 17 million in 2000. Then it crept up into 07 to 26 million, and then we had the so-called Great Recession. So granted, you would expect it to increase. However, it increased from 28 million in 2008, those on the SNAP program, to 45 million in 47 million in 2013, 45 million in 2015. That's equivalent to the population of 22 states. The entire population of 22 states was on the SNAP program. 16, 17, 18, 19, we've got a far better economy than we did 5 years ago. We've got many jobs that are going unfulfilled. The Farm Bill last year did have the idea of some work requirements. I believe it was between the ages of 19 and 56. If you were able-bodied and not caring for children, you needed to work. And if you still work, or 30 hours, I think it was, and if you still worked and your income met the demands, then you would receive the SNAP benefits. It didn't get passed. So what we now have done over the last 2 years is not change the criteria, to my understanding, but enforced eligibility requirements. We now have 34 million people, okay, last year, 34 million versus, years past. So in 2000, there was 17 million. In 2019, after reducing it, double that. That's still 18 states, all population on the SNAP program. So I guess you got to understand, it's a reasonable question with hundreds of thousands of jobs being created, a very strong economy, a 3.5%, not my district, mind you, it's higher. So I get it. There's still a lot of work to be done, and more people need to be included in this strong economy. But overall, it's going very well. And so placing reasonable work requirements on SNAP recipients, and by the way, if they can't get a job, the Farm Bill called for 20 hours of volunteer service would have sufficed, and clearly would not have raised their income levels that much. So they still would have been recipients. I just find it hard to believe that we don't want to really take into consideration levels of accountability and have an organized approach so the money is there for those who need it. So I make that comment, and I ask for your comments in response.
I think it's alarming how many Americans struggle with food insecurity. And I think rather than the concern being directed at how many people participate in SNAP, there should be concern about how many people struggle. It's 36 million Americans who are currently served by SNAP. You say it's 18 states. That's larger than the entire population of Canada. What's wrong in this country that many Americans struggle to put food on the table? And in terms of the increases in SNAP participation—
One could argue what's wrong with the organization and accountability and enforcement of eligibility requirements is what's trying to be done.
Well, I think you also need to recognize that SNAP helps the working poor, and the vast majority of working age adults who can work do work. And so we have low-income households who are receiving extra help that they need from SNAP, people who are working 2 or 3 part-time jobs. There is something wrong with that situation.
I do recognize it, but it is at a very, very high level, includes 18 states, 34 million versus 20 years ago, 17 million. That's a bit of a disparity. I yield, Mr. Chairman.
Thank you, Mr. Muser. And with no further questions, we can begin to bring this hearing to a close. I really want to thank our witnesses on both the first and the second panel. And I'd like to, I'll have a brief close, but I'd like to recognize my friend, the Ranking Member, Mr. Bilirakis, for a brief closing statement.
Thank you, Mr. Chairman. Briefly, again, I really appreciate you holding this hearing. And again, we got some answers today, but we need more answers. Obviously, we need the data. And then giving the USDA the authority statutorily to provide this data as well for our veterans. And again, no veteran should go hungry. I mean, all of us agree with that. I mean, we serve on this committee. It is our top priority, I understand, at least mine, and I know the chairman's, to take care of our veterans and their families. I do, but I do believe that, and again, we need to explore this even more, and I really appreciate your testimony, but I do believe long-term, we have to think long-term, and I think all of you agree that job training so that our veterans can provide for their families in the future is really the key. But short-term wise, sure, absolutely. No veteran should go hungry, and we'll continue to work on this issue. So I appreciate everyone's input today, and I yield back, Mr. Chairman. Appreciate it.
I thank the ranking member for his work on this, and look forward to continuing to work with him on a bipartisan basis to address this pressing issue. Thank my colleagues on both sides of the aisle for their thoughtful questions and comments today. You know, it's an interesting day that we're holding this hearing. We're voting on a war powers resolution later today, and I'm thinking of the men and women of extraordinary character who are serving this country and sacrificing for our national security. And the very least we can do is provide our military families and our veterans with food security. It's the very least we can do. So this committee asked earlier in this hearing how many veterans will be impacted by the administration's proposed changes to the SNAP program. And I appreciate that USDA agreed to work with VA to at the very least try to provide us with that data. But that doesn't tell the whole story, doesn't go far enough in my opinion. Our veterans are more than statistics, and furthermore, there are those veterans who are suffering from mental illnesses who are undiagnosed. How is this decision going to impact them? Be definitely worth that discussion. And hearing from veterans themselves, I think, is critically important. I look forward to working with you all and to making sure that that happens in the weeks and months ahead. I am particularly concerned with how USDA will work with VA to communicate better. Concerned that USDA didn't see fit to have a representative here to hear from these non-governmental experts in this area. It doesn't take an act of Congress to pick up the phone, to communicate, to speak with one another. Just takes a level of care and concern. We set the highest expectations of our military to serve our country, and we need to set equally high expectations of ourselves to serve them. We shouldn't be allowing a single veteran in need to go hungry, ever. If we want to serve veterans, we have to start by making sure they aren't hungry. This really isn't that hard. Again, I thank our witnesses for joining us today. All members have 5 legislative days to revise and extend their remarks and include additional materials. Without objection, the subcommittee stands adjourned.